from Piton Physical Therapy here on day 7, question 7 on our big 7 questions about vestibular therapy. I can't believe it's the end of the week, and I really hope you guys have gotten a lot out of this information. For our final day, we are asking what kind of exercises will I have to do in vestibular therapy. So really this depends on the condition we're treating, but there are 5 main types of vestibular therapy exercises. So first is canal repositioning maneuvers. These exercises are used if vertigo is due to BPPV. This is treated with different head and body positioning maneuvers in order to clear debris that has fallen into part of the inner ear called the semicircular canal, and it doesn't belong there. It's important for this to be performed by a trained vestibular therapist to effectively target the correct portion of the semicircular canal and clear the debris using the correct maneuver, because using the incorrect maneuver can potentially lead to debris falling into a different part of the canal or a different canal and making the symptoms worse. Second is if there is an underlying vestibular weakness from infection, age, or migraine-related disorders, we commonly treat this with gaze stabilization exercises. So gaze stabilization is strengthening the reflex that helps to coordinate your head and eye movement, called the vestibular ocular reflex. This helps to keep objects still as my head is moving. If you have a weakness here, you may not go around seeing double, but it may cause you to feel lightheaded and dizzy when you're turning your head quickly. Exercises with gaze stabilization might involve having you look at a target and turn your head and or your body at certain speed. We can add challenges by making the target you're looking at more complex, like a checkerboard background, or adding brain game challenges, or adding complex surfaces for you to stand on, like foam. Number 3 is called habituation. Now, habituation exercises are aimed at reducing symptoms through repetitive exposure to the movement that causes your symptoms. Again, if you're motion sensitive, this might not sound very fun, but as a trained vestibular therapist, my job is to break down an activity that you are having difficulty with and help train your vestibular system to understand that motion is healthy and motion is good for me. So, for example, if unloading and loading the dishwasher causes you to feel dizzy or lightheaded, we may just start by having you bend your head forward, wait until the symptoms resolve, and then bring your head back up, waiting for the symptoms to resolve and repeating it. That waiting period helps your balance system, including your vestibular system, to recalibrate to learn what's normal motion, and by repeating it, it builds up its tolerance to that motion. Next type of exercise can include balance exercises. We strengthen weakened systems to return to full function by challenging the surrounding systems. So if my vestibular system is weak and I'm visually dependent on what I see in my surroundings to help with my balance, performing balance tasks with my eyes closed can help strengthen my vestibular system. Different types of balance exercises can be changed by doing things like modifying the surface I'm standing on, or performing the exercises with my eyes open versus my eyes closed, and adding things like brain games and thinking tasks. The final one is just a side note, but if during your assessment we find that your neck could be a culprit to your symptoms, we may perform manual therapy to help improve the mobility of your neck, provide you with posture exercises, head and eye coordination exercises, and strengthen the signals that are being communicated from your neck to your balance system. Okay guys, there it is. That wraps up the week with the big 7 questions about vestibular therapy, and I am so excited that you took the time to learn from me this week about vestibular system, about vestibular therapy, its diagnosis, the assessments, the symptoms, and the treatments. At Piton PT, our mission is to empower individuals with dizziness, imbalance, and pain to live a better balance and active life. So if you or someone you know sounds like they're dealing with dizziness, vertigo, headaches, or imbalance, we would love to connect with them and learn more about how we can get you started on your journey to wellness, because these symptoms can get better, and they do get better. So make sure you share the videos with others so that they can learn more about how vestibular therapy may be able to help them or help someone that they love improve their quality of life. So reach out to us through the description below or leave comments, and we'd love to hear from you guys. Thanks everyone.